the epidemiology of the infection disease and the timelines for the infections and disease. So in the beginning, let's see. Okay, in the beginning, we will know about the definitions, what's meanings of the health care societal infections. So it's that it is then an infections that occurs in a patient as a result of the care at the healthcare facilities that was not present at time of the admissions to the facility. And also this lead to considerable morbidity also. And for that one is referred for infectious disease that occurs with 84 hours of the hospital admissions. So within 3 days or for discharge or 13 days actually after having receiving healthcare. So a total الهيلثcare also for responsibility for all the health care provider, also that for principle of the care to prevent healthcare or societal infections through not all the infections and can be prevented. As we know, we have many of infections that cannot be have hand to prevent for all this disease, but at least we make a protect for some of that disease can be take the precaution for this transmissions, about how can I be dealing with these infections and how can I be also protect ourselves about that one. And also for the hospital, the nurse can be reduced the risk and the big risk for the infections about even beside of the work practice that maybe can be reduce the rate of the infection and the exposures for the organism, or also for the infection regarding for any surrounding for the patients, maybe in the ward also, or in general in the hospital. And also as for example, for the microorganism have been found in the environmental surrounding at the patient, as I told you before, like example in the word, the nurse have already be careful about all these environmental surrounded the patients can be clear, and also about these precautions can save for both of side, for the nurse and also for the health providers and also for the patient. And also the the healthcare workers should be aware that can be back up the environmental contaminants or microorganisms on the hands or the gloves, even without providing direct patient care. It should be also be careful about these patients. We have some of disease, or they can be transferred the disease for them like this way. Let's talk about the impact of the pathogens. So about that one, the impact of the pathogens, the infections. So these infections entry and multiple for the organism, and also it should be careful and about and understanding what meanings about that actually. And let's see about if we have I'm sorry, can you hear me right now? My voice is clear, or yes? Okay, let's continue. Yes, about the infections. The infections is the entry and mental participations of the organism in the tissue of the host. And also these infections may be the clinical or subclinicals and maybe not protects the individual's disease. For the, my voice is good because I think I have problem with the connections. Okay, if you hear me, it's okay, that one. So, on the other hand, the multiplicity for the form from carriage and potential transmissions source. The timeline for the infections and disease. So we have some of period. This period can be really clear about how can I know about the disease, how can I be about the transmission of the disease, how they know about this symptomatic disease. So we have four periods, latent period, this in the beginning. So this is focused about the time of the period from the exposures to infections to become transmissions, pathogens to another individual. This is the first one. For another one, the inspections period, this one is the time for the exposures for the infections to the development as systematics period. This is the fourth one. To symptoms is become clear. This in the four period, the patient the person who already know he have like a fever, like something you really know about that he already take this infection. So infections period that period is time is during which is the host of infections. It's capable of transmitting the pathogens to another suspected an individual. So let's see some video here is talk about how can I know about the spread the infection. But let me see. This is here the what we talk about it. If they have any infection or we have عدوى من for regarding for another patients. So this here the period. So the exposures is the time is what happened. For this period here in the beginning is the time of become the diagnosis become is the patient is not, he don't know about he have already infections or not. So in expectations period is this period before the patient he recognized he have some of symptomatics like any symptomatics like not he feel it that before and until he feel like he already have the infectious disease and it's not is not meanings about specific diseases. There are many of the disease we have this in the infection control, and he's the systematic period how the person now he already have that disease, and after that one he already we see this the timelines about how we know about all the disease. So for this one here, let me say about before we talk about the epidemiology, we want to see some video.
مفيش وين ابويا.
Now let's see this video here.
We're going to have a look at how infectious diseases are transmitted and a few different ways to control their spread. First, let's have a look at how people can get infected with these diseases. In general, there are three main components that need to interact with each other for an infectious disease to occur. Mosquito or a tick. Now that we're going to have a look at how infectious diseases are transmitted and a few different ways to control their spread. First, let's have a look at how people can get in.
السلام عليكم، الصوت واضح؟ تمام. خلينا نبدأ نستعرض لأنه فصل من عند النت عفوا على بنشوف الفيديو الآن.
We're going to have a look at how infectious diseases are transmitted and a few different ways to control their spread. First, let's have a look at how people can get infected with these diseases. In general, there are three main components that need to interact with each other for an infectious disease to occur. This model of infectious diseases causation is called an epidemiological triad. The first component is the agent. This is the organism that causes the disease. It can be bacteria, viruses, parasites, or fungi. Second is the host, who is the target of the disease. The third component is the environment. This refers to the surroundings and conditions that are external to the host that allows the disease to be transmitted. In addition to these three components, transmission pathways between each of these allow the spread of infection. These transmission pathways can be direct or indirect. In direct transmission, the organism is transmitted directly to the person. This could be through touching, sexual intercourse, coughing, or sneezing. On the other hand, in indirect transmission, the organism is transmitted via an intermediate. There are several ways that this can occur. It can be through contaminated objects such as toys, soiled clothes, or even through food or water. It can also be through an intermediate vector, such as a mosquito or a tick. Now that we know how infectious diseases are transmitted, let's have a look at how to control them. Changing behavior can reduce or eliminate the risk of exposure to an infectious agent and prevent their spread. There are many different and sometimes simple health behaviors that can be adopted, including using condoms to eliminate or reduce the risk of sexually transmitted disease, regular hand washing, having a healthy diet, or using insect repellents. Behavior change is an important target of health promotion programs. Vaccines are one of the biggest successes of public health and have led to reductions and in some instances eradication of infectious diseases. Routine immunization of children has led to a dramatic decline in diseases like measles, diphtheria, and pertussis, saving countless lives. Vaccines not only protect the individuals, but by increasing the level of immunity in the community, also protect others. This is called herd immunity. Medication has been one of the mainstays of managing infectious diseases. Antimicrobial medication work by either killing the microorganisms or inhibiting the replication. They're not only used in treating diseases, but in some situations can also be used to prevent infections before or after being exposed to a disease. Pre- and post-exposure prophylaxis. A significant issue in the fight against microorganisms is antimicrobial resistance. This can happen when microorganisms develop resistance to drugs that were once effective against them. Antimicrobial resistance has been accelerated by the inappropriate or excessive use of antimicrobial drugs and has become a significant issue in the fight against microbes. Surveillance is a tool that is used to control infectious diseases. It is used to monitor diseases and their trends, characterize patterns of disease, and detect outbreaks. Surveillance can also guide the prioritization, development, and evaluation of disease control programs. In most countries, there are a number of diseases or conditions that are required to be notified by law. These are called notifiable diseases. Laboratories and doctors routinely send information to health departments who monitor them and act accordingly. Modifying the environment is another way to control infectious diseases. This includes activities like vector control, which is the eradication or control of vectors that can transmit diseases like malaria and dengue, ensuring that there is safe water supply, which leads to a reduction in waterborne diseases like cholera, Cryptosporidium, and hepatitis E, and improving sanitation facilities and hygiene, which can reduce the spread of diseases like Shigella, hepatitis A, and Salmonella. Other environmental measures include improving housing and working conditions, ensuring food safety, and enhancing air quality. Infection control in healthcare facilities is important because infections can spread quite rapidly in these facilities if proper precautions are not taken. Ways to prevent the spread of infection include proper sterilization of equipment, wearing appropriate personal protective equipment, isolating infectious patients, strict hand washing practices, regular cleaning, and having a good hospital surveillance system so that these infections are recognized and managed early. There are various other factors that contribute to the control of infectious diseases. These include broader measures like improving the social determinants of health, such as education and employment, having strong healthcare systems, and having an effective health workforce. Finally, the One Health concept recognizes that human health is closely connected to the health of animals and the environment. Therefore, successful control of infectious diseases requires the cooperation and collaboration of many specialties, including veterinary and environmental sciences. So that's a quick overview of controlling infectious diseases. We've taken a quick look at how infectious diseases are transmitted and a number of ways to control their spread.
And now we will continue about what we talked about the healthcare societal infections after we understand a little bit about the spread of the infections and how the infection can be spread. So let's continue. About the epidemiology of the infection disease, that risk factor of health cares or societal infections we are identified beside on epidemiological and clinical parameter, and also the general risk factors for the health of societal infections include a factor related to the patient, about the state of the patient, about the history of the patient, about if the patient have any history of disease, about how the immunity of the patient, and also the disease, the same the type of the disease, and how can I be dealing this disease with the patient if he have another disease also, and how also the management and determinant of this disease. This is also the role from both of sides, from the patient and also for the hospitals, and from for the nurses and the doctors also. And all these factors, and also that can be affected in general way and also in the specific way regarding about the patient, especially in the patient, because if he have the patient like hypertension and already have diabetics or any kind of this disease, and also face with some of these infectious disease, can be affected on him more than for another person. He already have good health and have good immunity, and even these determinants and these medications, some of that is benefit and can be give a good result about that the patients is how can it be the process of become recovery. And also this become difference between each person, as we know. So the elements are needed for transmissions of the infections in the healthcare. We need about we know about the source of infections, suspected of the host, and a model of transmissions. So as we know, the chains of the infection of transmissions. So if you want to know about this chains of infections is modeled to display an interconnected step that describes to how a pathogen is causes an infections. So this circle, these 6 links for the chains of infection, including the pathogens. Pathogens, that what causes of the pathogens can be bacteria, viruses, fungi, and parasites. And also what the receivers, about who's can be receive this and effects for who that one. Maybe can be including the people, the persons, the animals, the food, the waters. And the portal of access, that how can it be the way of the infections agnes leave to the reverse through the open wound, or maybe about the nieces, or maybe he have coughing or something, can they transfer for person to another persons. So the models of the transmissions maybe can be direct contact, and maybe in direct and direct contact also. البورتال of the entry, how can these pathogens get inside the persons? How can it be affect the systems of the respiratory systems, and these all the systems regarding all the patients. Maybe it's come inside of the mouth, noses, eyes, and the suspected host. Who's these people already have most risk to be have these infections early, because you know, even the persons who have older become his immunity less than more than another persons. Also the babies after birth, and some of people they have issue and about a problem with the immunity. They don't have a good immunity about any disease, what regarding about if there is any infection disease regarding about this one. So we need to break these chains of the infections. It's not gonna be there's any infections anymore. So for controlling and eliminations of the infections agents, so rapid identifications and installations of the resource, applying broader procedures, and also dissemination and sterilizations of the items and equipment that regarding also in the hospital about these places he have, as I said before, in the words, in some of the clinic, even for in general way in the hospital. And also the environmental, so important to be the environmental of the hospital always clears, because the pathogens can be an instant, the infections can be transfer from place to place, even for the patients who already get admissions in the hospitals and he's already okay, and after he discharge he gets these infections from the hospital, even after reports and after these tests they are recognized these infections becomes from the hospitals, like the infection sites, hospitals and healthcares. So it should be the environmental always clean. And so the controls of the receivers using disposable equipment, it is mentioned, and also the saturations of non-disposable equipment, and fight and control the infections in carriers. For controlling of the virtual of the access, paper control, and the extensions and environmental, also the waste disposal, the control of the transmissions, it should be hand hygiene. The hand hygiene is so important for all the time, not regarding about the infection disease, because some of the disease that not invisible in the hands, so it's more butters, it's not to just what the sanitizers only for to prevent from this disease. It should be also focused about to hand hygiene, and always to how can I do it that in the right ways. So source for isolations that's regarding about these hospitals, about these precautions, regarding about the transmissions like the airborne and the contact precautions, and this is already have another steps. We will talk about it inshallah with another lectures, because already this is a big mashallah big topics. We need to have more one lectures to be cover all these informations. And also about the control of the airflow for the food handling and environmental settings, and also for the controls of the portals of the entry, technicals and supervisory device scares, and control of suspectable hosts, identifying the high-risk patients and trained underlying disease. So that's all for our lecture today. If you have any questions, I will be glad to answer you in the chat. Any questions? I will be here to be gladly to answer you.